Introducing the fishhook tool, a self-therapy tool from Career Extenders. This tool is used by holding the handle, looping the stainless steel apparatus around to your back, and then pressing one of these tips into your back, neck, legs, etc. You can see there's a second tip here that you can slide over to make the tool a little more gentle, or remove it to have the tool do a little deeper work. These three little tools are used to lay on a yoga mat or carpet or flooring, and then you can lay down on them. They're flat on one side, of course, and pointed on the other. Very gentle, more moderate, and a little more deep treatment would be achieved by the three different tools. Now, I have also made a modified fishhook tool. It has the same handle for treating to hold in your hand, and then over here I have kind of married together the idea of the regular fishhook tool and the tool that you lay on. Combine them together and put it together in one tip on the fishhook 2. I can move the tips around. With my hand. So if I want the tip further down, a little further up, I can move it around and bring it up into my back. Oh yeah, there's a good place. I can, of course, keep more of my weight up on my side if I want a gentler, more gentle treatment. And I can lay right down flat. I want a more aggressive treatment, and I can feel I'm also relaxing it. I can feel the pressure there when I first lay on it, but every 10 seconds I feel it'll get a little softer. Sitting or standing position, I can of course use the tool in this fashion. I'm holding it with my hands, going around, and I'm using that. Use this virtually anywhere on the body. Could even use it in the bottom of my foot. And I could lay this if I was sitting in a chair and work the bottom of my foot, of course, in this fashion. And here's the fishhook tool, named for obvious reasons. But of course it's used to treat your back or neck or various parts of the body. Your hand goes on the handle, and then you can apply pressure to your spine, which is pretty difficult to massage yourself. Now, if you find that point a little bit too aggressive, you can just slip this over and you can use this more rounded tip, and it will give a much more gentle pressure. Depending on how tender an area is, healthy tissues won't have pain, won't have trigger points. Depending on how healthy the tissues are, you may need to start with the rounder tip and then progressively work to the more pointed tip as you start to get relief. I prefer without the rounded tip. I get a much better treatment for myself. I can go right along this SI joint. I can take this part of the tip, place this against the wall, and use this part of the tip to treat my back. That way I don't have to be using my arms to pull away here, so you can see that. Now the other thing that I'm doing is taking this hand, putting it on the wall behind me, and I've moved my feet out away from the wall. Now I could push my myself away from the wall with my hand if I needed to, if it was found a spot that was too sore. And you of course can bring this all the way up from the neck down into the butt area. I can also use this tip to treat my back. And I just hang on to the tool in the front and I can press into my back. The Fiscia 1, you can do this routine. The Fiscia 2 tool, it has the option of having the ability to lay against the wall and treat yourself. This is the cervical release tool, or the neck treat tool. I will pull this pillow up right tight against it, and then I'm going to lay down on it. So I recommend that you use a pillow. I'm going to put that tool right below my skull and before my neck. So I will place it right there. And as you lay on that, this is the flat, or relatively flat, less aggressive position. This one I would call the OA release tool. There was a osteopath in the 1800s who would tie a rope from one chair to another and lay on it and put that rope right in this joint right where I have this tool, and he found that he could get rid of his headaches by laying on that rope. Of course the chairs tend to slide together. It takes some improvising to get that to work, but I have, as closely as possible, simulated a rope stretched between two chairs with this tool. Of course, much more convenient. And I've got it right in between what's called the occiput, that's the bottom bone of the skull, and the atlas, which is the first vertebrae. And what we're trying to do by laying here is, slowly but surely as it softens, my head will fall back more and more, and we'll get a release in that joint. Again, I recommend you put a pillow there. If you have any neck problems, consult your doctor before you use this. Now I'll show you one of the other positions. That was that tip on top. You can put it in 3 different positions. Here's the second position. I'll move the pillow away just a minute so you can see. Pull the pillow back. Now I have the tool position more in the middle of my neck. And if you've seen a picture of vertebrae, which I'm sure you have, there's a little bone that sticks up out of the back of the vertebrae, or sticking backwards. And there are 2 bones that stick out of the sides. Well, if you line several vertebrae up, you get a valley between the bones that stick out of the side and the ones that stick out of the back. That valley is called the lamina groove, and this tool fits right in there. And of course that lamina groove, that little valley, is filled with neck muscles. Various names and do various things. So I can lay here, and both sides of my lamina groove are being treated. Now of course I can move it up slightly, and it's more tender when I put it up a little bit further, but as I lay here for a few seconds or a few minutes, it'll start to be less discomfort as the tissues start to get healthier. We're deactivating trigger points and getting blood flowing, releasing the muscles. Now I'm going to pull it down a little bit further, pull the pillow up. I'm not sure how well you can see it with the pillow there, so I'm just going to slide it away for a moment. I don't recommend you do this, but maybe you can see better exactly what I'm doing here. Pull my hair back if it's in the way. Now I'm going to slip that pillow under. That just allows my head to not fall back as far. You may find that as you use the tool, you may be able to use a little thinner pillow, but I recommend you use a nice fat one to start with, just while you're getting used to it, and if your neck is particularly in perhaps poor shape, you may always want to use that thick pillow. You'll have to use your judgment there. Okay, now there's a third treating tool, which I don't recommend you use right away, and that's these. You can see that these are more aggressive. Again, pull the pillow up. Now this one I'm going to put in the same position as I put the first tool, right below the bone of the skull, the occiput, and above the neck vertebrae. Again, I'll remove the pillow for a minute. I'm not sure if that's easier to see. Put the pillow back in. Now I can, when that starts to ease up, I can lift my head a little bit, turn it a little bit. Now get a little more into the side of the joint. I can turn my head the other way. Oh, now that's more sore on me. The left suboccipital muscle is much tighter, so I feel much more discomfort laying this way. But as I'm laying here, it's releasing. It's getting less and less discomfort as the muscles are releasing. This is treating some deep muscles that are underneath your skull and before the first vertebrae. They're called suboccipitals, meaning they're underneath the skull. Again, use judgment, caution. Check with your doctor. See if it's okay for you to use this tool. Let him have a look at this video. This is an area that's difficult to treat on yourself. If you've had some good massage therapy from someone who's qualified and very good at what they do, you know that it can really just change your life dramatically when you get some good neck work done if you have some issues there. And it's an area that's difficult to push on yourself. Many people intuitively will bring their fingers back and push in their neck when they've got a headache and they know they give themselves a little relief. This tool can make the treatment much easier. Basically, once I get the tool in place and the pillow in place, I'm just laying back and relaxing.